I am Lequita Brooks, your social impact speaker and strategist. Welcome to Social Impact Sundays at 6, where we have massive social impact that leads to massive income. And today we have Desirée. She is a radical, you heard me. She is a radical reproductive social worker and group therapy practice owner. Welcome, Desirée.
Thank you for having me, Lequita.
Yes. So, oh my goodness, Desiree, the fact that you are a radical reproductive social worker, like not just basic, not just the reproductive, like radical. We got to start with that piece. So, tell me, what was it that made you say, no, Lequita, like I'm not just a reproductive social worker? No offense to those who are just reproductive social workers. But for you, you was like, no, ma'am, I'm a radical reproductive social worker. So listen, tell me about your radicalness and all the things that you're doing in the reproductive world.
So that is a loaded question, right? But radical to me in this realm, and I think about my time in my master's program coming from Morgan State University, the National Treasure, HBCU, and how I was taught about practices from the motherland. How were Black people, how were Africans practicing healing ourselves, right? And if we are here as Africans in America to want to heal ourselves, we have to do that in radical ways. So not the status quo, not just your normal modalities and theories of, CBT, but there's other ways of knowing that attributes to our healing. So that's radical in the sense for me. So in the reproductive realm, I've done a lot of work, whether that's co-founding an organization, the Perinatal Mental Health Alliance for People of Color, which is a program within Postpartum Support International. I've worked throughout Greater Baltimore, Maryland, even though I'm in Milwaukee now. And then founding my practice, Motherland Co., based on those principles of radicalness and wanting to teach people how to heal themselves through not just talk therapy, but other modalities and using body work, energy work along with that.
You are a true example of how you took theory and the concepts and things that you learned and put it into practice. And it sounds like in multiple ways. There's a business that you own, there's something else that you co-founded. So tell me more about the first organization that you co-founded.
Sure. So back in 2016, well, really 2015, I attended a training through Postpartum Support International, wanting to learn about perinatal mental health after my own struggles with postpartum depression, undiagnosed postpartum depression back in 2012 with my first son. So I attended the conference in 2016 in San Diego. I met my two co-founders, Jabina Coleman and Divya Kumar. And we were like, we did that thing that most Black and brown people, when you're in a most white space, you're looking for the other people that look like you. And there weren't that many of us there, and we wanted to do something about it. And with the legacy and reputation of PSI, we felt like it was important to integrate in a way, but also to elevate. So wanting them to look at the program that they have, the wanting to expand reach to BIPOC professionals so that professionals of color will have the training and education that they need to disseminate information, education, and services to the communities that they serve, and mostly being communities of color. So through the Perinatal Mental Health Alliance, we provided scholarships to providers of color, mental health professionals that were interested in adding perinatal mental health as a specialty into their practice, whether they're a doula, lactation, mental health, it didn't matter. We wanted, whoever to be able to have that information. But we also know that there's an issue with referring. So you have the education if you're a doula or lactation or even an OBGYN or a midwife, but who is there on the mental health side to refer out to? So it's good to have the education, but we also want to encourage more BIPOC mental health professionals to get trained in perinatal mood and anxiety disorders. So that's how the alliance came about. We have really grown the membership at PSI exponentially. We have grown their BIPOC membership exponentially, and that is something that we're extremely proud of. Today we have a full team. There's a director, they have a communications manager. Like, they have grown and gone on and have done wonderful things. And as co-founders, that's just a really great thing to see, that you create something like a seed and it has just blossomed and grown to this beautiful, beautiful thing. So that is the alliance.
And you know, the interesting thing about all of this is that it simply started from, this is a problem that I have. I don't want pretty much anybody else to have to go through this. Like, this is pretty bad. And you know what? I'm actually going to get some education on this. And then from that, you connect it with others. So, and I know there are tons of other social workers that I've even encountered where they've had a problem, or they're like, you know what, I really wish there was somebody who did X, Y, or Z. But sometimes it's not easy to collaborate and connect, especially for people who are introverts. You might not believe it, but I am an introvert in real life. And you were like, you know, you all were at this conference and you all were there at the same time, at the same moment, having some of the same thoughts. Like, I want to connect with other people who look like me. And you all were able to connect. And now this something that you all planted has blossomed. But what would you recommend to others who are just like you, who have this vision and they don't want to do it solo? They want to have community and have partners. How would you, or what would you recommend for them to navigate doing that?
Yes. And I'm an ambivert. I would love to say that I'm an introvert, but not completely. But I just spoke about this to a group of social workers, the Association of Black Social Workers in Baltimore chapter, about networking and social impact. So that is something that I'm really passionate about, is social impact, social enterprise. And what that means, the key word in that is social, right? So you have to get out there, you have to network, you have to go to conferences. That has been my bread and butter of networking. I don't say this braggingly, but I tell people, if you ask me about a perinatal mental health professional, a doula, a midwife, a Black midwife specifically, in any state that where there are midwives or doulas and Black mental health professionals that specialize in perinatal mental health, I can give you at least one person in each state, at least. And that's just through networking, right? That's from me putting myself out there. A lot of this was grassroots and I didn't even realize it. I came back from that training in 2015 and I looked for the people that was doing the work in Baltimore. And I was like, okay, it's 4 or 5 people. Only one of them is a Black woman and no one accepts insurance when it comes to therapy. How can I change this? You have to put yourself out there. If it wasn't for me spending the money to go to conferences, I know conferences are expensive nowadays, right? But even virtually, there's opportunities I've seen amazing virtual conferences where there's opportunities to connect with people in chats and discussions and forums. Facebook is a beautiful place. I have a Facebook group of perinatal mental health professionals that I made in 2014 that has now over 7,000 members in it. And we connect and commune. Facebook is my other bread and butter. Like, I love to be behind a computer because it doesn't require me to go outside. If someone's asking a question and I know the answer, no matter if there's 15 other responses, still respond, right? Because that person may click your name and find out who you are and connect with you. It doesn't matter. Like, you have to put yourself out there. So the main part is to be social.
You're like, you gotta be social, Lequita. Pretty much. You gotta be social. And with that, since you are an ambivert, which basically means you are an introvert, but then you also have extrovert qualities whenever you need to. And with you having a group practice, I know that comes in handy. So tell us more about that, and also the states that you all provide services.
Absolutely. So Motherland Co. was founded in 2015 as Postpartum Recovery. I changed the name, I can't even remember. 2019 is when I was working as a sole proprietor for years, and then made it an LLC in 2019 with the name Motherland Co. We just accepted our first intern in the fall. So that's been a great experience. So my hope is that Motherland will be a teaching practice. Because one of the things that I hear a lot is I want to start a practice, a private practice, say new graduates, people that may have graduated within 5 years, and they want to have a private practice, whether that's solo or group. So my hope is by building a relationship with universities. Right now, I have a student at Salisbury University and their UGMC Europe program, who's from New Jersey, and I do practice in Maryland, Washington, D.C., and Virginia. So my hope is that I bring on students who, just want to know the ins and outs of a private practice, essentially. And from there, they can choose to stay on when they graduate with getting their LMSW. They can get their clinical hours from me, whether they're licensed in DC, Maryland, or Virginia. And then they can either stay on once they become fully licensed, or they can take their clients with them and start their own practice. So it's really a assembly line of sorts. From graduate school to private practice. I know some people don't agree with that, but I think it's important. There's so many avenues and places that people can go with that. And with the internship, they gain so much more experience than just therapy. They're doing projects on reproductive justice. They're attending conferences. They're attending the PSI 2-day training, right? I'm exposing them to other areas, not just the reproductive side, but we specialize in reproductive, race-based stress and racial trauma, and then overall life transitions. And as a Black queer woman, I think it's important to include all of my intersectionalities and identities in that. So that is what they get with Motherland.
And it's so great that you have a holistic perspective. It's not just therapy. You're like, no, we're doing some projects, we're doing some policy, we're looking at the entire, just everything as a whole. We're not just looking at it from one way. And since you are a radical reproductive social worker, what would be some things that you would say to other aspiring social workers, like, and also just changing some of those outdated narratives? Like, being radical is just not social worky at all, and I'm like so for it. So what would be some of those narratives you want to get rid of too?
I think the main thing for me is, and this is what I teach my students, I'm a practicum director, is at a college, and I'm like, don't think that you just have to do this one thing, right? Social work is whatever you make it. It could be whatever you want it to be. I originally went into social work to become an adoptions social worker. I ended up working in child welfare for 13 years. I told you Keisha Atley was my former supervisor. And it wasn't until I had my own personal experience with trauma and depression that I actualized my own path, essentially. I created my own path by going the perinatal mental health route. My concentration was school social work. I wanted to be a school social worker, right? Like bachelor's, I want to be an adoption social worker. Master's, I wanted to be a school social worker, and have not worked in a school since I graduated. So don't feel like you have to be in this bubble. Social work is definitely not a box at all. We are so broad in all the things that we can do. So I would love to kill that narrative. Like, this is what I have to do just because my school has this major. This is what I have to do. And when I look back, I'm like, oh, I should have did the public health concentration instead, because now I do mostly public health work. But it doesn't have to, you can change paths at any time. Don't feel like you're stuck in one place, and you can and will make money off of those paths. Okay. I've done so many amazing contracts. I'm now working and have a contract in a tech space with an upcoming maternal health app. Like there's so many branches to what we can do. So don't limit yourself. And no, ever limit yourself. If somebody says you're doing too much, because I'm a manifesting generator as a human design, so be it. Like I have a bunch of interests, organized chaos, so to speak, but you can do whatever you want and you can change your mind at any time.
You can do whatever you want. Your personal experiences can lead to the path that you're meant to be on.
Yes.
And also, it's okay to be diverse and broad and do all the things. And sometimes chaos isn't bad.
Absolutely. Yes.
And any other last parting words you'd like to share with our audience, Desiree?
I say get in touch with people like Lequita if you are unsure of what that path is. I'm also available for, questions and consultancy. Like, I don't know, like I'm interested in reproductive health, but I don't know if I want to do therapy. Like there's so many different things. So I'm here as a resource. I always tell people get on my calendar because I'm a wealth of information and I love giving information. But make social work what you want it to be for you.
Make it what you want it to be. And how can people connect with you, Desiree?
They can connect with me on Instagram at Motherland Co. Or becoming Dr. Israel. That's my personal, but I still do a little bit of marketing on that side. But also they can email me Desiree at motherlandco.com and just check out my website, DesireeIsrael.com and motherlandco.com.
Well, thank you so much, Desiree, for joining us on the social work movement today.
Thank you for having me.
Yay! So I am Lequita Brooks, your social impact speaker and strategist. And make sure you get involved with the social work movement by going to thesocialworkmovement.com. Once again, that is thesocialworkmovement.com. There are multiple ways for you to get involved. And I'm your host of Social Impact Sundays at 6. Until we chat again, have an amazing day.